Okay, so now we're going to do the other half on the cholinergics and anticholinergics in chapter 19. So if we'll go to the next slide, and again we're talking about the autonomic nervous system, and we're dealing with the parasympathetic side, or the cholinergic. Sympathetic is the adrenergic side, parasympathetic is the cholinergic side. And this is what it does here. So again, keeping focused on this, and I'll keep referring back to it as we go along. Parasympathetic response. So the parasympathetic system affects the two of the muscle systems. There's three muscle systems, the cardiac, skeletal, and smooth. So here you can see it affects the muscarinic or skeletal and the nicotinic or smooth muscles with the release of acetylcholine. Remember, the sympathetic or adrenergic is the release of epinephrine and norepinephrine. Now we're on the left side, the parasympathetic or cholinergic side, and it's the release of acetylcholine, which directly affects muscles. And you'll see that with some of the disorders that are managed with cholinergic drugs. When, again, thinking, let me go back. When you look at the systems, you think of the sympathetic nervous system as the fight or flight, and the parasympathetic over here is the rest and digest or feed and breed. Here we go on the parasympathetic, the rest and digest or feed and breed, because of the systems that it affects. So the different types, we're first going to go into the direct acting cholinergic agonists. They act directly on that muscarinic muscle receptors. Most of the cholinergics affect the muscarinic or the skeletal muscles. So the selective mean they pick select muscles, which here is that they select the muscarinic, the smooth muscles located in the heart, the GIGU, and the glands. So that's where you see the specific places that where it affects. Metoclopramide, often referred to as Reglan, increases gastric emptying. There's been some problems over time with this, so it's not used as often because it can lead to a problem with like tics, not worse than tremors, but actual tics, tardive dyskinesia. Which so some others, the pilocarpine is used in drops to constrict your pupils. Remember, this is cholinergic. If you picture what your parasympathetic or cholinergic system does. So your cholinergic system constricts your pupils, stimulates salivation, decreases respiratory rate, heart rate, slows down everything. So that's why it would be used to constrict pupils for certain procedures. And it's used to treat glaucoma, decrease the pressures in the eye. The next slide here gives you a good picture with the cholinergic sludge of exactly what the cholinergic drugs will do. Going into the some other specific drugs here, we're now into bethanechol. I'm used to it being NUR choline, that's the name it often goes by, but we need to go generic, bethanechol. And it can cause this blurred vision, meiosis. Meiosis is nearsightedness. If you didn't know, that's what that term means. Hypotension, bradycardia, sweating. Again, if you think it's stimulating certain things, slowing down others. Sorry. It's contraindicated in bradycardia, hypotension, obviously, because it's going to slow everything down, and you don't want, with the low blood pressure, to lower it some more. It increases the things in the gut, because it's the opposite of the sympathetic system. And so that's why it's contraindicated with ulcers. You need to teach the patient to monitor their blood pressure and heart rate to rise slowly because of the hypotensive effect. To give one or two before a meal or a couple hours after a meal, you're monitoring the gut, the bowel sounds, that sort of stuff. Indirect acting means it doesn't act on one specific place. You see the functions here to break down the cholinesterase enzyme and to allow acetylcholine to activate the muscarinic and nicotinic cholinergic receptors. That's why it's considered an indirect, because it works on more than one of the receptor sites for the cholinergic or parasympathetic system. And it stimulates the skeletal muscle, increasing tone. Again, those restrictions are because of the effects it has. If you look back at your picture, drugs in this class are used often for management and diagnosis of myasthenia gravis. Myasthenia gravis is probably something you haven't studied yet. You may be a little familiar with it. It's a neuromuscular disorder that causes weakness in the skeletal muscles. There's a problem with the communication between the nerve cells and the muscles, so they cannot contract and work appropriately. So with these cholinergic drugs working to stimulate the skeletal muscle communication, conduction, that's why it is an appropriate group of medicines to treat this. Indirect doesn't work on a specific receptor site, was the donepezil, which I keep wanting to go with the brand of Aricept, but it's used for the treatment of Alzheimer's, increasing memory. Next slides go into more specifics on this particular drug, donepezil. It's taken at bedtime, small meals because of the nausea and vomiting that can go with it, because remember, the parasympathetic stimulating that whole gut. And side effects can be insomnia and fatigue. The fatigue because of the muscles, and the insomnia is I'm not quite sure why insomnia when I think of rest, but insomnia, but I could think of the fatigue because they say rest and digest. Increased risk of GI bleeding, especially if you're adding the nonsteroidals with it, because there is an increase in gastric acid production. So when you add nonsteroidals like the aspirins, ibuprofens, which already block prostaglandins in there, and it can increase the risk for bleeding, so that combination is real bad. Reversible cholinesterase inhibitors. Reversible in that they don't last as long as what they call the irreversible. Some examples here in your text. Table 19.2 just goes down all these that I just broke up into a few slides. So pupil constriction in glaucoma, and then neostigmine is used mostly for urinary retention post-op, because it's so short acting. It can work with myasthenia gravis, but the pyridostigmine, which is moderate acting, and then I've never given this one, abenamine, benonium, I can't even say it, sorry, that it is long acting. These two here, second and third one, are more common to be used with myasthenia gravis, and to help them be able to have muscle contraction and some muscle strength. So obviously the side effects will be the opposite, the muscle cramps, twitching, bradycardia, increased bronchial secretions, and cramping. Again, you can remember those if you just think of the sympathetic system. Parasympathetic system, sorry. Okay, nursing implications. What do you need to look for? Taking them as order, never stop them abruptly, because if you think of the tremendous effects on this with everything going, the opposite, overdosing, can cause life-threatening problems because everything is slowed down. Some more nursing implications, and all this is in your text too. But remember, in your teaching, when you're taking donepezil or Aricept for Alzheimer's, that it is not a cure. It can help them, but it takes up to 6 weeks to reach therapeutic levels to have some sort of effect on it in improving some of the memory. Anticholinergics. It means anti-going against. These are cholinergic blockers. They work against, so they do the opposite. They decrease that acetylcholine release in the parasympathetic nervous system, so you're going to see the opposite effects. So large doses increase heart rate because it takes, the one will slow it down, but not significantly. Okay. Lungs, bronchodilation, again, because the parasympathetic will cause a decrease in your respiratory expansion, so the opposite, which will, the anticholinergics will have the opposite, so they'll look more like the sympathetic response when you look at all these symptoms here. This is often used, anticholinergics are used in treating Parkinson's. You see this decreased tremors and rigidity. So acetylcholine is the problem in Parkinson's. So the blocking of that acetylcholine release is why it is effective. Anticholinergics are effective in Parkinson's disease. Contraindications: glaucoma, paralytic illness, tachycardia, myasthenia gravis. Of course, you don't want to block anymore on this myasthenia gravis. They already have the muscle weakness. And again, the side effects are going to be the opposite of the parasympathetic, look more like the sympathetic side. One way to remember anticholinergics is a saying, I can't see, can't pee, I can't eat. Or one person said, it dries you out like a desert. So can't see, can't eat, can't pee is a great way to remember anticholinergics. Some specifics of anticholinergics are atropine, and that has a box on chart 19.2 on page 275 in your text. The nursing interventions are obvious, where you're going to monitor those vital signs. Check the gut for peristalsis, because it's going to decrease your salivary secretions. You're going to need to give good mouth care. And it would be contraindicated in glaucoma because rather than constricting, it's going to dilate those pupils, and it's going to increase the pressure in there, and that's the last thing you want with glaucoma. That's just going to worsen the situation. Atropine is mostly used for cardiovascular disorders, second degree, third degree heart blocks, things like that are used during a code situation when they are very, very compromised. I started talking about the interventions before: vital signs, output bowel sounds, provide mouth care and eye drops because those things are going to be dried out. Avoid hot environments. Like I said, you can't see, can't pee, can't eat. Anti-Parkinson's. I mentioned how acetylcholine is the problem in I'm sorry, it is late and I am tired. Parkinson's has a problem with acetylcholine where it doesn't release it, so if you block the cholinergic, you have an increase in the acetylcholine available, and you have a decrease in these involuntary movements of Parkinson's. I am so sorry. Go back and scratch notes I had from before. I've just had a problem with the computer, and I've recorded 4 times today, and I was just determined to get it done, and I finally got the system working, so bear with me. Remember to learn the generics. I would focus more on this benztropine or cogentin because that's a very common one of the most that's been around the longest. Okay, anticholinergics can be used for treating motion sickness. If you think about the slowing down some of the things in the gut and the dizziness, it has antihistamine. Scopolamine usually comes in that patch. Dimenhydrinate, which is over-the-counter Dramamine. Haven't really seen cyclizine much. Meclizine is very commonly ordered for people with vertigo. Oh boy, I'm glad I'm almost to the end. I'm tired. I apologize again. And side effects are anticholinergic. So there's going to be that dry stuff because it's blocking that parasympathetic acetylcholine. Okay, anticholinergics used for respiratory. The big one here is ipratropium bromide. You'll usually have heard of it as Atrovent, but we need to know generic ipratropium bromide because it is opposing that parasympathetic that wants to decrease that and help open up some of that breathing. So it is often used in combination with adrenergic drugs to treat respiratory issues. It relaxes those smooth muscles in the bronchi and the bronchioles and decreases the airway resistance. It's used for exercise-induced bronchospasms, chronic bronchitis, asthma, and COPD. That's the reason I'm doing the respiratory section after this section, because of some of these drugs that correlate. Nursing implications, assessing for allergies, obviously. Assessing for presence of BPH. You don't want to give it to them if they have benign prostatic hypertrophy, which is a benign enlargement of the prostate gland. This benign enlargement of the prostate can cause a partial urinary obstruction, so you certainly don't want to worsen that issue. GI/GU obstructions, these are things where you want to be careful with their use. Blurred vision may cause problems with driving, obviously. Sensitivity to light. And I think that's... No, one more slide. Okay, more nursing implications. You see here when you give the drops of an anticholinergic, you want to put just a slight pressure in the inner eye there because you don't want this to get into the systemic system. And it says here about dry mouth, can give them chewing gum, hard candy. Usually lemon drops are the best thing in the world for that terrible dry mouth because it's drying up the salivary glands, because the parasympathetic stimulates them and this anticholinergic, which goes against it, dries that up. Constipation, tremors, just think again, look at your parasympathetic system, what it does, and think of the opposite, and you will have your side effects. And that is the end of this chapter. Thank you.